A surprising twist in Trump's legislation, unraveling the impact on Medicaid and millions of Americans. Imagine being told that a major legislative effort, one proudly called a Big Beautiful Bill, has significant cuts to Medicaid, a vital program supporting millions of low-income Americans. That's the eye-opening revelation from President Donald Trump's stance on his new bill, which heaps critical cuts onto Medicaid. According to a private discussion he had with House Republicans, Trump advised lawmakers that winning elections means keeping programs like Medicare, Social Security, and notably Medicaid untouched. But herein lies the contradiction. The bill significantly slashes Medicaid funding, potentially reducing its budget by up to 18% and leaving around 8 million individuals without coverage. But here's where it gets controversial. For months, Trump has consistently assured the public that protecting Medicaid is a top priority. This recent misstep has presented an awkward dilemma for Vice President J.D. Vance, who's been emphasizing the need for the GOP to appeal to lower-income voters. This week, Vance tried steering the focus away from Medicaid cuts on social media, labeling them as immaterial compared to the importance of immigration enforcement funds. And this is the part most people miss. Behind the scenes, many Republicans are uneasy about these cuts. Internal communications reveal that Republican lawmakers are concerned about the consequences of these Medicaid reductions. There's a discernible gap between the public narrative and what many in the GOP might recognize as necessary: controlled statements about reducing waste, fraud, and abuse. Despite these claims, the reality of severe Medicaid cuts is tough to ignore, especially considering the potential impact on rural hospitals that depend on Medicaid payments. Why the deep cuts to Medicaid despite the promises? At the core of this legislation are Trump's key priorities: tax reductions, funding for immigration enforcement, and adjusting the debt ceiling. Although these initiatives come at a high cost, House conservatives demanded that some spending cuts be included to help offset the financial burden. Conservatives soon focused on areas where large-scale cuts could be achieved without provoking widespread backlash, especially targeting Medicaid. Medicaid recipients are viewed differently by conservatives compared to other beneficiaries. This viewpoint is slowly changing as Trump's coalition includes more low-income voters, including rural white and Latino populations who depend on Medicaid. Recognizing this, the GOP has opted for less radical Medicaid cuts, but has still implemented strategies that ultimately lead to substantial reductions in coverage. For instance, introducing new work reporting requirements, while theoretically just a procedural change, could complicate the coverage process for many working individuals, eventually leading to loss of benefits. Additionally, restricting the provider tax, a key element for state Medicaid funding, brings significant financial implications for states reliant on Medicaid support. So, what do you think? Are these cuts essential to managing the federal budget, or do they endanger the most vulnerable communities? Share your thoughts in the comments below, and let's discuss the balance between fiscal responsibility and social support.